This next portion, we will go over how to screen. Please keep in mind, each PSP program runs differently. This is Clay County Public Health Center's process for dental screenings. Most supplies are provided by the state's Preventative Service Program. Gloves, protective eyewear, masks, 3-ounce paper cups, paper towels, a flashlight, and hand sanitizer are provided by Clay County Public Health Center. You may bring dental loops if you have them. Use a new mirror for each child. When screening, visually inspect the entire oral cavity. Use the PSP screening form as a guide when conducting screenings. Here's an example of a completed PSP form. This form was revised April 2019. It may look different from the previous video you viewed from the Department of Health and Senior Services. Numbers on the left side of the page, 1 through 4, include the child's demographics, and on the right side include screening findings. When a child sits in front of you, the screener and/or recorder will use their best guess for the child's gender and race. The screener will need to ask the child how old they are. We typically know ahead of time the grade we are screening. Therefore, the screener and/or recorder can mark the appropriate bubble for grade. As a reminder, only fill out number 11 and 12 for a child that is 5 years and younger. These numbers will be left blank if the child is 6 years or older. After the PSP form is complete, mark the child's screening card appropriately. Mark the child's treatment urgency code and list your name in the other line. In the comments section, you may write a brief note to the child's parent or guardian. Many times, a child will be screened with gingival inflammation and moderate to heavy plaque. You may write, "Please assist the child in daily brushing." This lets the parent know that even though the child does not have obvious dental decay, their oral health needs to be monitored. Here is another example. Dark pits should be checked if not done so in 6 months. This would be appropriate when the child is found with a dark occlusal surface and does not show apparent decay. When writing in the comment area, do not use diagnosing terms and try to stay away from dental terminology. For example, instead of writing possible maxillary anterior frenulum attachment, you could write possible lip tie. Early dental concerns will be marked on the screening card if at least 1/2 millimeter of a tooth structure has been lost due to possible dental decay. This picture is an example of early dental concerns. Urgent dental care needs include children who have possible and/or rampant decay, pain associated with the lesion, or possible infection. You may write on the card if the child states pain. Here is an example of urgent dental concerns. When speaking to children, please refrain from using diagnosing terms. See the slide here for other options. If a child is found with early or urgent dental care needs, add the child's name and notes to the tracking sheet. You do not need to give SOAP notes. Feel free to keep it brief. Here are a few examples. Instead of writing baby tooth lower right possible abscess, you could simply write BTLR possible a ? This keeps it short and sweet. RDH leads typically have 1 office day per week. If you have any questions or concerns, please notify both RDH leads by using the addresses found here. The RDH may not see your email if you send it the day before or the day of the event. If you are unable to make the event or have a last-minute question or concern, please contact your instructor. Thank you for your interest and support of Clay County Public Health Center's school-based dental program. See you there.